Some people needing emergency care do not need to be admitted to hospital to receive it. Ambulatory Emergency Care, or AEC, is a way that people can come to hospital to get assessed by a senior hospital doctor and to get any tests or treatments that may be needed. All this can happen without having to be admitted to hospital overnight.
I've discussed with the specialist in the hospital, and I think you need to go to what we call the Ambulatory Emergency Care Clinic.
A practitioner in the community has assessed you and believes that you need to come to hospital. This may have been your GP, an advanced nurse practitioner, a paramedic practitioner, or a pharmacy practitioner. Instead of an emergency admission to hospital, that practitioner thinks you might be able to get the assessment, tests and treatment that you need within a single day, or sometimes as an outpatient over a few days. The practitioner has already organised an appointment for you in AEC. It is important that you attend immediately to allow the appropriate investigations to be carried out. The staff in AEC will be waiting for you to arrive following the call from your GP surgery. You do not need to go home to pack a bag. If you need to stay overnight, the hospital will supply a complimentary hospitality pack with toothbrush, etc. You can find us at Ward 101 on Level 1 in the Emergency Care Centre, Green Zone at Aberdeen Royal Infirmary. The AEC is on the floor immediately above Accident and Emergency Department. On arrival, please inform the receptionist on Ward 101 that you are here to attend Ambulatory Emergency Care, or AEC. Ambulatory emergency care sees people with a whole range of problems, so it is difficult to be specific about what might happen to you. You can expect to be welcomed by one of the nurses or healthcare support workers who will take some details and take your blood pressure, pulse, oxygen levels, and perhaps a tracing of your heart or some blood tests. You may be asked to go to the waiting room after these tests until the advanced nurse practitioner or doctor is ready to see you, or you may be seen straight away. The advanced nurse practitioner or doctor will then explain to you what needs to be done and how this will happen. Sometimes you may have to stay a good part of the day, depending on test results, but we will let you know if this is likely to happen. You may be asked to go for a chest x-ray, a Doppler ultrasound scan, a lumbar puncture, VQ scan, an exercise tolerance test, or a CT scan, depending on your clinical presentation. Because ambulatory emergency care sees people on an urgent basis without waiting lists, we are unable to operate a robust appointment system. We see people as soon as possible on arrival and try to get tests and scans organised as soon as we know what is needed. Unfortunately, this can sometimes mean having to wait a while. Some scans, such as a ventilation perfusion scan or VQ scan, or a computerised tomography scan, CT scan, need to be reported by a radiologist, which can add to your waiting time. Your practitioner or consultant will then come and discuss your results with you. Whilst the aim of ambulatory emergency care is to deal with as many health problems as possible in a single day, it may be that you require a treatment or test that cannot be done on the same day. If this is the case, and the doctor thinks you are well enough to go home in the meantime, you may be sent home to come back the next day for further tests or a review. You may be referred to another department in the hospital for further tests or treatment as an outpatient. If this is the case, the practitioner or consultant will explain why and will make the arrangements for you. On some occasions, the doctor may decide that you are not well enough to go home. You may need to be admitted for observation, or you may need further tests or treatment as an inpatient. If this is the case, the doctor will explain why and ask if you would like to be admitted to hospital. Following your assessment and any tests or treatments, it could be that your health problem can be managed at home and with the support of your GP practice. If we think that this is the case, we will discuss this with you and will let your GP practice know. If you have any urgent problems out with normal GP practice hours, please call NHS 24 on 111. If you have a genuine medical emergency, you should call 999.